Okay, Joan, you can go ahead.
I apologize. I was on mute. Welcome, everyone. Welcome to the first of our pre-conference webinar series. We are so delighted to have you joining us today. This is the first in a series of five webinars that are going to be presented. This one is Rethinking Dementia Care, Lessons from the Netherlands on Autonomy, Innovation, and Culture Change. On behalf of CFI, our conference committee, we are delighted that you are a part of this and have an opportunity to get a little bit of a sneak preview of what is coming in August, but also an opportunity for all of us to learn and grow from the incredible people that are in our space, that work in our field, and have so much to share and so much for us to learn from. So I'm going to turn it over to one of the members of our education committee and a member of the board of directors for Center for Innovation, Jessica Lou Kim.
Thanks, Joan. Hello, everyone. So nice that you can join us live. And for those who will watch the recording, thank you so much for joining us. So as Joan mentioned, my name is Jessica Lou Kim. I have the privilege of being a CFI board member, but I'm also an educator and consultant in the aging and healthcare space. You're probably wondering, why is she on this webinar? Well, in 2023, I had the real privilege of going to Europe with a dear colleague and mentor of mine, Dr. Alan Power. And one of the countries that we visited was the Netherlands. And I have to tell you, I absolutely loved my time in the Netherlands. I learned so much. And so when the conference planning committee and I learned about our speaker's work, we got excited. I got excited. And we thought it would be kind of neat for me to join this webinar and engage Roshan in a conversation about his insights, his observations, and key takeaways so that we can glean it and apply it into our own work in North America or wherever you're tuning in from. So, with that, I'd like to welcome and thank Roshan for joining us on this webinar all the way live from the Netherlands.
Hello, everyone, and thank you, Jessica, and thank you to the CFI team and Pioneer Network for hosting and having me. But my name is Roshan Betkerur, originally from Chicago, Illinois, and currently I'm a researcher and a current Fulbright scholar at Maastricht University in the Netherlands.
Great.
And what I'm doing here is I'm studying the Dutch approach to dementia care, and today I'm going to share some of those insights and those lessons that I've learned. And I hope that you as professionals and working in this field can apply some of those lessons to your work.
I'm sure everyone will find so much value. Roshan, can you tell us a little bit more about your work experience here or in the US and tell us a little bit more about the Netherlands
Yeah.
and the work that you're doing there?
Yeah. So a little bit of my background. I got interested in long-term care and dementia care specifically when I started as a certified nursing assistant in high school, where I began working in nursing homes. And that was about 6 years ago now. And I've worked both in a greenhouse model style and as well as more traditional clinical settings that you might think of. And through those years, I really began to see some of the issues and the hardships that we faced providing care for people with dementia. And that was in terms of freedom and choice and just the overall setting. Um, and around this same time, my family, we also began looking for long-term care for my grandfather in India. Um, and this was also difficult because long-term care in India is culturally different. Um, so it was just this culmination where I'm experiencing these issues professionally in my work, but also through the hardships and stress that my family is going through to try and find a caretaker for my grandfather. And I think just the culmination of that, the mix of both of those things sort of nagged me a little and I sort of started asking that question of how can we improve long-term care? Um, yeah.
Wonderful. And tell us more about what you're doing in the Netherlands.
Yeah, and then sort of as I started thinking about how can we improve, this is where I came across the Netherlands, and I applied for this Fulbright scholarship to research Dutch dementia care models and the initiatives that are going on in the Netherlands, because they're really known for putting out innovative models, having a progressive approach. And some of the things that I'm doing is I'm looking at innovative living arrangements for people with dementia. So this means looking at the types of nursing homes they have here, such as green care farms, dementia villages, and small scale living. I'm also doing some look into some of the policy and meeting policymakers to really understand how does Dutch policy allow nursing homes to be innovative, and what's allowing them to drive for that change and strive for the future. And with that, also doing site visits, shadowing physicians and caregivers, understanding that approach to care, how they are culturally different in approaching dementia care. And Fulbright is of course a great program, which is the source of the funding and the connections that's giving me this opportunity to come abroad and study these initiatives. And it's sort of this bridge between the US and the rest of this world, collaborating in education and research and really making sure that all sides benefit. And I just want to talk about also a little bit more about Maastricht University, where I'm doing the research here. And I think this is something we can all also take away. And here we have something called a living lab. There's about 10 across the Netherlands. There's even one in the UK. And what it is, though, it's a collaboration among nursing homes, care organizations, and some of the universities in the Netherlands. And how it works is usually a university will send a researcher or a PhD student to be assigned to a project or an initiative at one of these nursing homes where they'll do research and sort of explore and develop this model to see if it works or doesn't work. And it also goes vice versa. So a caregiver or a physician at a care organization can come do research at our university. But it's basically bridging the gap between person-centered care and the research world. And it goes both ways. And there's this overall commitment to improvement that we see on all parties. But what is that benefit? What is the overall benefit that we see? And that is really care organizations can go to policymakers and the government and say, hey, we have this new practice or this new model, and we think it should be standard across the industry, right? And we have the research, the evidence to back that up. And I think that's very crucial, right? When we want to make improvements, strive for the future, it's important to have research on your side. And I think nursing homes, healthcare organizations, and people like you in the US, we can open our arms more and be open to research that's going to allow us to improve and explore new possibilities. And I think that's something we can all do a little bit more of.
That's amazing. What a great opportunity for you. I'm really curious to know, you've said you've done some work in the US and now you're in the Netherlands. What are some of the key differences between the two countries in the ways that we support people living with dementia?
Yeah, I think there's a lot of differences. Maybe I'll talk about the US first so we can kind of set a groundwork. But a lot of what we see in the US is a medical oriented approach. A lot of times when you walk into a nursing home in the US, you'll see scrubs, you'll see nursing stations, medical carts, and it's really a hospital style layout. And I think there's a lot of reasons for that, right? In the US, I think we run at a higher volume. When you look at the population, the Netherlands has about 20 million people, but America has about 400 million people. So that's about 20 times the size of the Netherlands, right? So we're operating at a much larger scale, and there's a lot of things that come with that. We're trying to cater to a lot more people. This also comes with hiring more staff. In the US, we face a lot of staff shortages. I've experienced it as a CNA where, me and the nurse have been assigned to 18 patients when someone calls off. And I'm sure those of you that operate or have seen nursing homes also understand that, we're operating at a scale. And when you operate at that scale, there's a lot of things that go into that. And sometimes we might be prioritizing quantity over quality. But when we see that in the US and how we need to provide for as many people as possible, we tend to overlook how can we improve and become better at the same time, which is, I think, what the Netherlands has been trying to do better of in sort of pushing for that progressive approach. And when we look at the Netherlands and compared to the US, what we're starting to see is a lot of informal avenues of care. And we're starting to see different kinds of nursing homes appear, a lot of them run by families or independent organizations or community groups. And sort of we're seeing these innovative types of models come up where they're trying new forms of care and trying to provide different kinds of care for different people. We're seeing a lot of intergenerational involvement. So this means getting younger generations involved with older generations. Now you have that sort of cross-generational learning and mutual understanding, trying to make sure everyone is understanding where everyone's coming from. We're also seeing a lot of community involvement. So this means bringing the family involved with care, even when you go to a nursing home, right? I think in the US, we think that when we put someone in a nursing home or someone is living there, all the care falls on the responsibility of the nursing home. And I think what we're seeing in the Netherlands is a push to also get family very much involved with the care, even in a nursing home. This means coming over, taking them out for walks, helping out with the laundry. It's a community approach, a community involvement, and we want everyone to be working together to really improve the health for the residents.
Can I just ask a quick question about that? Are the
Yeah.
family members joining as volunteers or do they have paid roles as well?
Um, no, I think majority of what I see is a push for family members to sort of volunteer their time whenever they can. It's not mandatory. It's not someone's working a job, but when you have the time and you have the time to come in and really spend time with your family, one, it gives time and space for other caregivers to sort of focus on other things, but it also allows that connection to stay there for as long as possible with you and your loved one, which is important. We want people to always still have that family aspect in their life, even when you go to a nursing home. So that's a very key part. Um,
Great, thank you.
yeah, and then also I think another one of the big things that we're seeing in the Netherlands, a lot of nursing homes are starting to get rid of that medical oriented approach. We're starting to see the demedicalization, the deinstitutionalization of nursing home care. And one of the biggest steps that people are making is they're getting rid of scrubs. It sounds really simple, but basically they're sort of going into a more casual approach, wearing normal everyday wear, making it more normal, more home-like for people in a nursing home, right? This is someone's home. It's not a hospital or a clinical setting. This is a nursing home. And so yeah, we're seeing a lot of variety, a very progressive approach, the commitment to improvement. And I think one of the biggest things is we're seeing a large scale to smaller scale living and these sort of innovative types of nursing homes.
That's great. That's really helpful to know some of the differences. You know, Roshan, one of the things that we've been hearing for the last 10 years that's come out of the Netherlands is the Dementia Village. And apologies for my bad pronunciation, but the Hogewijk, is one of the ones that many people know about. But for those who aren't familiar with it, tell me more. What were your observations about this
Yeah,
community?
and when we really look at the types of nursing homes in the Netherlands, one of the first examples we hear about is the Dementia Villages, and specifically the Hogewijk, which is the first of its kind. It was established in 2009, so it's been there for a while, and I think over the years they've gotten a lot of publicity and they've been very vocal about their approach. So many of you have probably heard of it. But what it is, the goal of the Hogewijk was basically to mimic or curate a traditional Dutch neighborhood for people with dementia, to really introduce a sense of normalcy and familiarity of where Dutch people may have lived at once. And the communities, they have a small scale living approach. So many of the neighborhoods or houses that the residents live in have 5 to 6 residents. They have their own living rooms and kitchens. But also the Hogewijk, the village, has a lot of normal things you'd find in a Dutch neighborhood. So they have a park, they have streets, they have a cafe, a grocery store, a movie theater, a lot of things you'd find in a neighborhood. But when it comes to the dementia villages, I think over time we start to see that there's always things that we can do better. There's always ways to improve, right? And I think one of the big takeaways from the Hogewijk was that at the end of it, it was still an enclosed care community. And while the residents there, they had the freedom to move about the care home, there still wasn't so much involvement or access to the greater community, right, outside the nursing home. And when this started in 2009, it was a great innovative idea, and it was then seen as a place but then it was then through research and through examination, it was a place that didn't give complete freedom to the residents, right? They weren't completely open up to the real world. And so there has to be better options, right? And when it comes to people with dementia, especially the Dutch cultural approach believes that everyone with dementia deserves that autonomy. They deserve that freedom to move and make their own choices and do that in the comfort of their own home or a home-like environment.
When I was there in 2023 and I see my colleague and mentor Al Powers also joining in the webinar, we had the good fortune of visiting 2 green care farms, and I absolutely loved those experiences. And again, I'm going to butcher the pronunciation, so please give me some grace here. But one of the green care farms that we went to was really focused on the day experience, and it was called Herzebergen, and it was managed by Helen Jungerberth and Dolph Becks, and loved that one. The other one that we went to visit was Rotenhout, and it included a day experience. It included living accommodations. They also had short stay. The director, Francine Vanderven, was also highlighted in the recent documentary Human Forever. Lots of great things about these green care farms. I know you visited quite a few. Can you tell us more about what you've seen?
Yeah, I'm really glad you got to visit green care farms actually, because you don't really get a feel for them until you actually step into them. Um, but green care farms in the Netherlands, they have sort of become the gold standard to dementia care in the Netherlands right now, especially when it comes to research. There's a lot of involvement in sort of exploring what does that mean. And currently in the Netherlands, there's about 1,000 green care farms, which is a lot. 200 are specifically for dementia, and of those 200, about 40 are now residential. The first one was established back in 2013. And actually, the first green care farm itself, as a day activity farm, it was established in 2005 in a dairy farm. So it took about 7 years for them to go residential and start to take in residents full time. So it takes time, right? Developing and trying to develop a good model of care. And for a long time, we hadn't really heard about green care farms, mainly because they were independent, family owned and operated. And many of them were also located in rural parts of the Netherlands, right? And they existed for people that lived in those communities with dementia. So they more so did their own thing in caring for people with dementia freely and really connecting them with nature and giving them that home-like environment. But over time, as they become more established and researchers began to get very interested in them, we sort of started to understand how they operate. And I think one of the biggest things that really struck us about green care farms is the openness and the freedom that exists for people with dementia. And a lot of the work that we do now is looking into how they operate and that approach. I think one of the big key things that we see is the closeness to nature is sort of the primary hallmark of what a green care farm is. Promoting residents to be active, to be outside, to be in nature, and that grounds them and connects them with the world outside. And it's a really big part of it and how we approach care and green care farms. When we look at the actual residential part of it itself, we see that they're very casual. They're very home-like. They have neighborhood style, about 5 to 6 residents per home. And they're quite calm and tranquil places to be. And really, once you step into one, you feel what it actually is and the freedom that people have to step out of the nursing home into a garden and seeing animals and seeing people working in the garden, going on a walk freely without needing supervision from a care provider. And at the end of all that, it's still a licensed nursing home and they still provide nursing care where necessary. But there is a lot of variety when it comes to green care farms as well. And what you see here in this slide is one of them. So this is De Hoeve, which is kind of close to where I am here in Maastricht. What you can see on the left side of the picture is the farm part. You can see the stables on the left side and the garden going through the center. And you can see the common areas. It's actually very interesting because this is one of the green care farms that also pushes for community involvement. So the cafe that they have inside this nursing home is also open to the public. So when my parents actually came and visited last fall, we actually, I took them there and we sat and we had a cafe and there was residents passing through. We walked around the gardens. It was sort of an interesting environment and a new world for them too. So it was really cool to show them that. And then on the right side, you can see the residential part, which they created as the addition to the green care farm. And you can see all the rooms, they open up with balconies and they open up to the gardens directly so they can go directly outside. And you can see that openness, the direct access to nature to be as part of the farm and really experience what it's like to live there. The next one here is Riershoeve, which is it was also established in 2013, so they're kind of one of the pioneers in green care farms. You can see in some of these, it is very big garden, a lot of green space almost there. It feels like the nursing home is engulfed in green. but it is a very nice place, and they have small scale living as well. So a lot of the residents live in neighborhoods of 5 to 6 residents where they share a kitchen and a living room together. But here there's also that freedom. Residents can go to other neighborhoods. They can go out into the garden as they wish, without restriction or without supervision.
Can I ask a question? It looks like in the picture that they're attached. Is that the case?
Yes, so this building has everything attached. So all the neighborhoods and all the residential communities are all together, which is also a good thing, right? Because this means that different people this means that residents are allowed to go into different parts of the nursing home, interact with different kinds of people, and then also go outside wherever they like. So it is one big facility, but obviously they have really taken being connected to nature to the full extent. Here's some more pictures actually. They have animals on the property. They have mules and goats and sheep and cows, as you can see here. They have huge garden, vegetables and flowers and fruits. And there's always residents there tending to the weeds, and there's always care providers helping and taking people around and volunteers. Here's some more pictures of residents sort of working in the garden, and it's all volunteer. And here's another one. So this is a different kind of nursing home. This is also a green care farm. It's called Zorger. And what you really see in these pictures, which really stands out, is this doesn't look like a nursing home when you first look at it. It looks like someone's house. It looks like a traditional Dutch house with a living room, a piano. The entrance has these coat hangers like a normal house would. The kitchen is not an industrial kitchen, but it's really just a home-like kitchen, something you'd see in a traditional Dutch home. And something that they try to emphasize here is making sure that people live in an environment that they've always been comfortable. People with dementia tend to get confused, and when they're in a clinical setting, there's a lot of things going on, a lot of moving parts. But when you make something feel like home, something that they've always known, there's that sort of comfort that comes with it. Here's some more pictures of sort of that living environment. Sort of just looks like a normal house. And there's multiple houses on their property. And I think one of the interesting takeaways from Zorgurf is that what they really emphasize, so some of their community areas where they do community activities for all the residents and sometimes they eat, it's actually detached from all the nursing homes. And so what residents have to do, no matter what, they have to put on a jacket, that is put on their shoes, and they have to walk through the garden, through the neighborhood to the community center. And I think the really important part to this was what they really tried to emphasize was that that's a daily part of life, that the residents need to go outside, whether it's rain or shine, day or night, summer or winter, right? That's a part of life, and they should be outside and they should experience that even when you have dementia. There should be no limitations to that. And I think it's something that really sets them apart and something that they really aim for. And
Yeah,
here's some
I love
pictures.
that part. You know, that's something we observed too in one of the care homes that I mentioned earlier. And the access to bikes, lots of walking paths
Yes.
as well. Yeah. Sorry, I
Yeah.
interrupted you.
No, all good. And when you look at also sort of the inside of these nursing homes and you look at their rooms, a lot of residents have it is very home-like, but they also have the support that you need that you would get in a nursing home, such as the supports in the bathroom and even in their rooms to make sure that people are still safe where needed. And they give people total freedom to have their own rooms, access to the gardens, and really sort of maintain their autonomy while also giving them that freedom to be outside. Um,
Can I ask you one more question,
yeah.
Roshan? If you can go back a slide,
Mhm.
you know, where were the bedrooms located in some of these different green care farms? Was it all one level? That I noticed in one picture there's two levels.
Yeah, it depends. Some of the nursing homes, some of them have 2 levels. Some of the neighborhoods have 2 levels. For some residents that are still able to walk and still able to go up the stairs, they will sometimes put their rooms on the top level so that they continue to use the stairs and they stay active. But there are also places where the rooms are on the ground floor and connected to the gardens and that sort of thing. So it varies.
Great.
And with that, I think before we go ahead and go on to sort of what are the advancements and sort of what we're pushing for through these green care farms. I kind of want to see where we're coming from. So we have a couple of poll questions that we'd like you guys to answer, and then we'll kind of have a discussion about those. So if we'll give you guys a few minutes, go ahead and fill it out and submit your answers. There's no right or wrong answer, just answer what you believe.
While people are doing that, Roshan, do you mind putting the links in the chat? Or would you like me to? Some of the places? I think people might be interested.
Yes, I can do that as well.
Why don't I do that?
Okay, no worries. The presentation also has everything linked, so
Yep.
you guys will get access to that afterwards. You can look them up.
Great. How are we doing for the poll? Oh, it looks like there's responses back. So let's look. For the first question, residents with dementia are at more risk of falling when they can leave their nursing home or community setting. Most people disagreed. Question 2, doors leading outside of nursing homes should be closed for residents with dementia. Most people disagreed. Number 3, residents with dementia will get lost if they can leave or walk around. Most people again disagreed. And last, if I end up in a nursing home with dementia, I hope the doors to the residential community are closed. And most people disagree. I think you have a very enlightened group there.
Yes, which is a good thing. It's glad to see that a lot of you are reaching for that openness. You hope that one day you will have that openness, and you also are sort of understanding that maybe that risk is worth taking, which I think is really interesting. But it's also we shouldn't also ignore the people that said agree, right? Why do people still believe that it's not a possibility? And we should also be curious as to what those reasons are, because that's the reason we're holding back. That's the reason that people have not yet to make that change. And it's important to also understand that side and how we can change that and push for that change.
Absolutely. Great point. So what advancements have you been seeing in the Netherlands as
Yeah.
it relates to open door policies?
Yeah, and that this sort of builds off those polls, and I think a really big thing of what we're seeing in green care farms specifically, but also starting to translate in larger nursing homes as well, as we're starting to see open door policies. And what they are, it's basically gives residents with dementia the freedom to move among rooms, among common spaces, the gardens, and even the external community. That means they can leave the nursing home if they please. And really it's that push for giving people with dementia that freedom of choice. And there's a lot of understanding that goes into this. And one of them is that one, not everyone with dementia wants to leave. Not everyone with dementia has the urge to escape or go outside. And one of the mottos that a lot of nursing homes use and green care farms use is that if you're free to go, you choose to stay. And it's sort of getting over that mindset that people won't necessarily get lost or run away if they have the choice. And it's also looking at the risks, right? A lot of the risks that people say they fear when you give people that freedom of movement and you open the doors is that maybe people will get confused or they'll fall when they leave, or they'll go out onto a busy street. But I think one of the arguments to that is that falling in confusion, that's a part of life. That's a natural way of life, and we all experience that. And just because you have dementia doesn't mean your life should be limited in that way, and that you should still be willing and have that opportunity, because that is a part of life, and that is what we experience. And I think in the Netherlands specifically, when we look at open door policies, people see that risk as worth taking, that it's the right thing to do, that the risk is more minimal than we think it is. And I think in the US, what we prioritize a lot is zero risk. We really want zero risk. We don't want any mistakes or any faults. But in the Netherlands, what I've realized is that people are okay with taking that risk if that means people get to live a better life. People with dementia get to have more freedom. Um, and we've seen this on all levels. This isn't just the nursing home level. In fact, the Dutch government has even gone in their laws as to label closed doors as a form of restraint, and they've made it sort of mandatory that nursing homes start to move towards open door policies in a more open environment. So what we're seeing is a lot of nursing homes start to implement that change and start to open up and experiment with that.
Yeah, I love that because, one of Pioneer Network's values is, and Joan Devine mentioned it in the chat, is risk taking is a normal part of life. I think back to Francine Vanderven, who was the manager and director of Rotenhout that we visited. She said, with life, there comes risk. If you don't live, you don't have any risk. And I noticed you also captured one of her sayings, if you're free to go,
Yeah.
you choose to stay. Yeah, that was a pretty profound statement from her.
Yeah, exactly. And I think it's really amazing how, especially in a lot of these communities, people have that mindset and that openness to take that risk. And it's communal. Everyone thinks that way. And I think one of the hardships that people realize in nursing homes, say a more traditional setting, when they want to open that up, um, there's a lot of disagreement, or there's not continuity in how people think. Certain people might think of things differently. Certain caregivers or certain administrators may see an open door policy differently, and the consequences and effects that it has. And I think having that alignment is one of the hardest things when people make that change. But for Green Care Farms, a lot of them have had that openness since they started. So a lot of their care staff are very comfortable, and the residents are very comfortable in operating in that way. So it's very interesting how different facilities have had to implement that and how people are going about it, because it is changing.
Can you tell me more about your points under physical changes?
Yeah, I think some of the physical changes, and we kind of went a bit over this, but I think in the Netherlands, we're seeing that large push for smaller house designs. And this even goes to a lot of traditional nursing homes sort of starting to convert their nursing homes into these smaller house designs, creating neighborhoods where there's about 5 to 6 residents per neighborhood, and they all have their own bathrooms, their own living rooms and kitchens, and that's sort of what we're starting to see. That's what we see in Dementia Village. That's what we see in Green Care Farms. There's that push. Another thing would also be, I think, which is very key, and I think in the US, we need to utilize this more, is utilizing our outdoor spaces intentionally. We see that in the Green Care Farms, and we also see that in other nursing homes, but allowing people to be outside, to interact with the gardens and take a walk. I know in many nursing homes in the US, we have amazing gardens, and there's always this opportunity to go outside, but a lot of times we limit that, or we say that residents can't go out unless they have supervision under a caregiver, or someone needs to be with them, or there has to be an activity outside for them to go outside, which just simply is not utilizing the space that you have effectively and intentionally, which is something that we can do more of when we already have that, and when we have that implemented, we need to learn how to use it better. And that's something very important. And then one more thing, I think a physical change is what we're seeing, especially when working with people with dementia. When there's a lot of different things going on, it's caregiver continuity. And what does that mean? It means when you're working in a nursing home, that you have the same care staff interacting with the same residents, or living in that same neighborhood, or working in that same neighborhood. That way the people with dementia feel, okay, this is my home, and there's the same people living in my home all the time, and I'm comfortable with these people. We know how we operate, and that creates less confusion, less stress when you have that continuity of caregivers, and you're using that space intentionally, and everyone is familiar with one another.
Yeah, I agree. That is such a key point. One of the things that you're doing is very interesting. Do you want to describe more about that on the next slide?
Yeah, and I think I'm going to loop this back around. So this is kind of what the research is focusing on that I'm doing now and what I'm doing here. And this goes back to open door policies and how people are implementing that, how people are viewing that, and sort of asking the question, how free is free? Um, and when we look at this, when we're trying to examine how open door policies work, one of the things that we need to understand is how do staff working at these nursing homes view open door policies. And so what we're trying to do is we're trying to understand overall what the attitudes of nursing home staff have. And so when I asked you guys those poll questions, right, I'm trying to see which way are you guys leaning? Are you leaning towards a more positive attitude towards open door policies, which luckily a lot of you were, or is it more negative? And what we're trying to see is how does that compare across organizations, across nursing homes, but also within a care organization. And here's sort of a diagram to help you picture that. So looking at green care farms and small scale living and traditional nursing homes and comparing how does that attitude compare across those three? Then going down to the care staff within those nursing homes, how do nurses and administrators and physicians in a green care farm view that open door policy? How does that compare between one another? And then also looking at how does that compare across nursing homes again? So how do nurses in a green care farm versus nurses in a traditional nursing home view these policies? And I think this is very important because, like I talked about, I think having that alignment in a nursing home that where all people agree that this is how our nursing home should work, this is how we should approach the care, having that alignment is important. And when you want to treat people with dementia effectively, and when you want to run a nursing home effectively, you want to make sure that there's alignment in how your staff view your new policies, view your care initiatives. And you want to make sure everyone's on board. And I think this is a big thing when people introduce new policies, especially something like this, which is very crucial in how we care for people with dementia, that we understand that everyone looks at it differently and that everyone should try to be on the same board and provide the right training and have the right attitude when approaching these open door policies. So that's a little bit about the survey that we are putting out now.
So is this live right now? This survey is taking place at this moment?
Yes, we are actually just putting it out this month. We've been sending it and started sending it to different care organizations, different types of nursing homes, and starting to gather data. So we're sort of in that process now. I can't explain too much about the results or anything yet, but it is ongoing, and we're excited to share that one day.
Oh, we can't wait. When I heard about this is something that I know myself and many people who are viewing this now will want to know. So how can they get a hold of you after, Roshan?
Uh, yeah. Well, we had, I think, some
Oh,
takeaways first.
yes, that's right. Before we get
Yes.
there. And we do
Yes.
have quite a number of questions coming in. I'd love to get you to sum up some of your key takeaways from your time in the Netherlands. I know it's not over yet. You still have so much important work to do that we're excited to hear about. But what are some of those key takeaways you would want for us to think about and your call for action and how we can do things differently?
Yeah. I think one of the big things is have some empathy when you're caring for people with dementia and you're working with residents and long-term cares. Have empathy. How do you want to live when you grow older? How do you want to live if you ever end up living in a nursing home? And make that change now for yourself and for the people that are there right now. Um, Another big thing, we talked a lot about this, being more casual at trying to establish a home-like environment, trying to make a place that's comfortable, introduce normalcy. Remember that we're in someone's home. This is someone's home. Someone lives here. This isn't a hospital or somewhere where people are just coming for treatment. People live here and they want to be comfortable. Um, and that also comes with proactiveness. When you're living in someone's home, you want to involve the residents in daily activity. Their whole life, they've lived at home and they've done chores such as folding laundry, doing the dishes, cleaning the countertops. I think we can do a lot better as caregivers, as managers, as involving residents in these activities. They want to feel encouraged and supportive. Um, and it's important to keep encouraging residents with dementia to keep being involved in these daily activities. It really engages them, engages their mind, and keeps them active. And it's important that we don't let them forget that for as long as possible.
Roshan, do you want to move to the next slide? I'm still seeing the survey one.
Ah, sorry. There we
That's
go.
all right.
Okay. Yeah. And then I think another big thing, which is what we're starting to see more of based on your guys' poll, when we were talking about the stigma in terms of falls and running away and confusion, tackling those, making sure that, trying to see that maybe those issues that we face aren't as big as we think, and that taking those risks and allowing people to have that freedom and taking those risks and letting people with dementia go outside or utilizing your environment and your gardens to the maximum potential and really going against those misconceptions and trying to change that perception is very important. And of course, all these things start with small changes that we as caregivers, we as managers make in our day-to-day. And I think we can all do better, push for that change, push for improvement. And through some small changes and things like these, we can really start to introduce a more open environment for people with dementia and really give them the freedom and autonomy that they deserve.
Love that. Before you move to the next slide, the chat is blowing up. It's so nice to see so many people joining us. We do have quite a number of questions, but there's a few comments I want to highlight. Al's comment, U.S. providers live in fear in large part because of unrealistic societal, regulatory, and liability pressures to eliminate risk. We do need to accept risk, but providers can't do it alone without support from these other sectors. The Dutch government's classification of locked doors was restraints is a hugely important move that needs to happen here. Absolutely. There's another comment by Sharon. We also need to change our thinking from medical or quantity of life model to a more social, programmatic, interactive model focusing on quality of life living, especially in the dementia world. Yeah, there's comments about fear and oversight and maybe changing the way that our regulators view living and the way we support people living with dementia. Al also said he's finishing up his manuscript with Dr. Jennifer Carson and Pat Sprague for a book on unlocking and desegregating memory care. So this really ties into a lot of these comments. So Roshan, before we get into the Q&A, because there's quite a number of questions, remind us, tell us, how can we get a hold of you? Because we're so glad that you're now part of our community, and we can't wait to learn more about the good work you're doing.
Yes, and if you have any questions after this webinar and you want to reach out to me, this is my email, and you can also connect with me on LinkedIn and message me there. They all work, and please do. I would love to connect with all of you and stay in touch and answer any questions that you may have in the future.
Great. Well, we do have some questions coming in the Q&A, and Joan, feel free to come and join me on our virtual stage. So, Roshan, you can see the Q&A box as well, right?
Yes.
Okay.
Just before we go to the Q&A, because this ties into quite a few that are in the Q&A, there were a couple questions about, Rosemary Fagan asked the question, are there any regulations to protect residents? How do you protect residents from bad actors? And kind of an overriding theme that was in a couple of the different comments, and you'll see in the Q&As, what is the regulatory environment in the Netherlands as compared to, for here in the US? Because it's that fear of risk. It's that fear of litigation, of being tagged, the fact that we're being told protective oversight is our responsibility, that oftentimes is what keeps people from moving forward and keeps us embedded in those old beliefs because we may believe in them, but we're afraid to act on them.
Yeah, and I think one of the big regulatory things is it's also sort of in how people understand them, but it's when you choose to live in sort of a green care farm or a place that's sort of unconventional, a lot of the times you as a family or you as a family member are agreeing that these are the risks that your loved one or your family might take by living here. that the openness that exists, it's prefaced that when you're living in a nursing home like this, that openness exists, that risk exists, and we all agree that we take that and that we understand that. So there is transparency there. It's not saying that like um, it's not like people are not expecting it to happen, but everyone sort of knows that this is the way it is and this is the way of life. And there's that understanding from the get-go that that's how it is. Um, so yeah, I don't, I hope that kind of answers the question. I'm not super familiar with the specific regulatory practices or things that are implemented and how they manage that.
As you've worked with the people in the Netherlands, Roshan, have you found that they are more open to this
Yes.
risk-taking, to these concepts as a culture versus the US culture?
Yes, as a culture, as a people, they are very open to sort of giving people that freedom, that it's a human right, that it's a simple fact that everyone should have that, no matter, even if you're in a nursing home, even if you have dementia.
You know,
And
one
we
of
all
the
know culture is the core of everything.
Exactly.
You and I have talked a little bit about it, but I love the fact that there's a real focus on normalcy, normal life, and that includes risk. And that
Mhm.
living, is really the ultimate goal. And if you have too many restrictions in place, when you limit opportunities, that's when life isn't a life worth living anymore.
Mhm.
Yeah. So there are a few questions,
Yes.
and I'm wondering if it makes sense to kind of go with the flow of your talk. One of the questions that came up was you mentioned the Dementia Village, but if that's not the future of care, then what is? Should these villages represent the future of nursing homes? There's ongoing controversy around whether such communities are ethical, especially when they're enclosed, as you mentioned. What do you see, in your opinion, as the future model of care for people living with dementia?
Yeah, and I think that's kind of what I talked about, was also saying that I explained what a dementia village was, but I also explained that that openness and whether they're ethical or not, that question has always been coming up, and that's also why we talk a lot about green care farms now, is because um, that openness and having that freedom is very important. And I think that's sort of the push of what we're seeing in the Netherlands, and that's like I said, the Dutch government has put in the regulation that closed doors are a form of restraint, and I think that's the future, is opening up nursing homes to be more free, to give autonomy back to the people with dementia. Um, and I think that's largely what we're seeing. We're seeing that push to small scale living, to places like green care homes, small scale living facilities, and even big traditional nursing homes are starting to renovate or change their model of care by remodeling and switching to small scale living, even within the care home.
So, Rashawn, this kind of ties into a couple questions that were asked.
Mhm.
The comment always comes up when we look at these models, which certainly the greenhouse has proven itself to be a very powerful and good quality outcomes here in the US, and yet oftentimes the fear is the cost. We can't possibly afford to do something like this. So can you speak a
Mhm.
little bit to the cost of this kind of model, both in terms of the operational side, the creating these wonderful communities, but also what kind of staffing, how do you staff these models in a cost-effective way, or just how do you staff them, period?
Yeah, I mean, it varies. There's a lot of different kinds of models. One of the things that we're seeing for cost is a lot of these green care farms or nursing homes is they're buying already developed properties or already developed land, and then remodeling them to be a green care farm or a nursing home, which is very effective because they're saving money by buying property that's already been developed. Um, when it comes to staffing, a lot of these green care farms, obviously they have your necessary staff, your CNAs and your nurses and your administrators, and they have all those things. But also, green care firms operate on a much smaller scale, so they may not have sort of the specialties such as a social worker, or a dietitian, or those sort of things. Those things happen internally, between families and the caregivers, and it's a little more informal, which is something that we don't see in the US, I guess, because things are very systemized. So they do work a little differently, and it's hard to understand, a little bit maybe, but um, it's it's something that obviously happens, I think, a lot more internally in these smaller living communities.
I have a follow-up question that kind of ties into staffing. You mentioned continuity of care partners and team members. The question is, how are the communities, the green care farms doing in retaining the talent and that continuity of
Yeah.
people?
Yeah, and I think this is very important. Because when we look at a lot of nursing homes here, a lot of the care staff, they may be people that may have never had a career in healthcare, but then they made the switch and they start working in a green care farm, and it's very natural for them, and they're immediately drawn into that openness, that kind of community style living where everyone's very supportive, it's very family-like, the families of the residents are involved, and everyone's involved with one another. Um, and I think they do a really good job of retaining those people because they maintain that community style where everyone's supportive and everyone's working together. I'm not saying that people don't do that in a big nursing home, but I think just the casualness of it, the home-like environment of it, not working in a formal setting, really makes a difference in how we approach the care, and that we're working with, while we are giving skilled nursing care and skilled care to people, we also need to understand that we are also just there for them as friends and as family, and living in and we're working in a place that is their home, and we should also treat it like that and treat it like our home, which I think is a big difference.
There are a couple of questions related to outcomes. One of them is, has there been any, evidence to say that green care farms have better health outcomes than more of the traditional nursing homes? Have you come across that at all?
Yeah, we have seen that there are some advancements. A lot of the work at Maastricht University we do is sort of exploring that openness and the effect that the openness has on people with dementia, and sort of the overall environment. And we see that people with dementia tend to be less distressed or less confused living in an environment like that. And there is research that goes into that. I'll link it maybe afterwards, but at Maastricht University, we've started doing a lot of work with green care farms and exploring that openness and the impact it has on residents, um, and the overall impact. But like I said, they're also relatively new. So some of the key health factors that maybe we've looked at traditionally in larger nursing homes, we haven't observed in these types of models yet that you may be thinking of. But it is coming and it is starting, and we're starting to become very interested in that as well.
Great. So make sure you send us those links and we'll communicate that out. One of
Yes.
the questions that comes along with that is the medication usage too. Is there been a reduction in inappropriate or just medications in general for those that are attending or living in those green care farms? Not sure that's a
Um,
question you can answer, but
I don't know too much specifically, but at the end of the day, these are also skilled nursing facilities, so they do have access to all of that, all of the medication that's necessary. Um, they still do have access to that when it's necessary and when they need to use it. Yeah.
Joan, should we move on to some of those other questions?
Wait, here's one that I think people might be interested. A couple questions on this end is in terms of the level of when someone is end stage in late stages in their dementia or the disease has progressed, are they able to stay in the homes, and is end of life care provided in the homes that you've been talking about?
The answer is yes. In fact, um, it's actually very interesting because the Netherlands has gotten very effective at making sure that the people that are in nursing homes are there when they need it, and they're really in the last stage of their life where they can't live at home anymore, so they have to move to a nursing home. So I think the average stay of a nursing home in the Netherlands is about 9 months to a year. So people are really coming in and living in these nursing homes at the last stage of their lives when they really need it. So yeah, people are here end stage at all levels with dementia. So
So
it
it
is.
sounds like from what you just said, and if I interpreted this correctly, that in the Netherlands, people do stay at home longer.
Yes, that there is a push to age at home and be at home for as long as possible, which is very important. Yeah.
Which also changes the dynamics with the family, I would assume.
Yes, exactly. But I think this also goes into that push of that community involvement, having the family involved and everyone's involved with your care. Um, yeah.
Interesting, very interesting. Here's
Mhm.
a question someone asked. They said in the States, some health departments have serious concerns with animals in these type of settings. Do you see that is there's a more progressive view in Europe and specifically in the Netherlands?
Yes, for sure. I mean, when you look at the animals and the things that are on these green care farms or in these nursing homes, they do have their own enclosures. They're not just roaming around or walking into the nurse. There's not cows walking into the nursing home or anything. So there are laws that protect them and that make sure that they are where they are supposed to be. Um, and there's very little fear that these animals will do any harm to the residents. And right, it is a farm. It's our domesticated animals. So. Um, I haven't heard of I haven't heard of too much concern with the animals.
There we go. Well, and there was another question. There are a lot of questions about funding, and it sounds like, again, from what you talked about, money of this is private funding, and so obviously clarify that. But in the regulatory environment, and one of the concerns was, especially when you have different funders coming in, at least it's something we certainly see here in the U.S., is while we know and we truly believe most people come into this with a good heart and want to do the right thing, there are sadly bad apples that do arise. And
Mhm.
so that's where, in our system, the regulatory really seems to have a focus on, and sometimes looking for the bad apple makes it difficult for those who want to be creative and do something different. So what do you see? Are there ways that this is being watched, that that they're assured that these homes are being built in a way that truly are the best option for the elders that they serve?
Yeah, and at the end of the day, they are still licensed as skilled nursing facilities, so that they have to oblige to certain regulations and health checks. Um, So they are still abiding by a set of rules. They're not just operating informally without regulation. And also to say that they're all private, you still can go live in this nursing home under insurance or under long-term care insurance. So those options do exist. It's not that they're all private and you need to pay with your own money, but there are other options to funding as well.
Roshan, one of the things that I'm sure people are curious and a question came up related to this is the training. Because you were a CNA,
Yeah.
have you noticed any differences in the training and the requirements to become a team member?
Yeah. So I think it's very interesting, and I think this also goes with how some of the regulatory practice might be different. So I've noticed that in some nursing homes, you don't need to be fully certified to be a nursing assistant or a helper in the nursing home. Um, so I've heard that also in the green care farms, what a lot of people like to hire, they like to hire people that don't have an extensive healthcare background. Because if you're coming from a place that has a traditionally more clinical approach, and you come to a green care farm, it's going to be hard for you to adjust to that openness and that new approach to care. And you'll come with that mindset of working in a traditional nursing home. So what a lot of the times they like to do is they like to get new staff that may have not worked in long-term care before, or they might be new to this to get on board, because then they can train those people to have that mindset from the start. And that's how they learn, and that's how they train in that openness, in that setting, and they're comfortable with that from the beginning. Um, so there's a lot of that, especially when it comes to training and hiring new staff in these innovative environments, making sure that it's people that really understand the environment that they're going to be working in.
One of the things that I consistently saw was in the green care farms I went to, and I think from hearing your presentation, is the person's engagement in the daily life, in the daily activities. of the Green Care Farms. Can you expand on that more? Because there was a question on how are residents engaged? What are the services
Yeah.
that residents may take part in?
Yeah, and a lot of it is tending to the animals, feeding the animals, getting to work on them, going to the garden, picking weeds, watering the plants during the day, planting new crops in the spring and harvesting them in the fall. So a lot of things, and they like to keep it very hands-on, um, especially in the gardens. But this is also a nursing home, so they also do other things. They play bingo. They do all sorts of things that you'd also expect in a nursing home. They play games and they watch movies, listen to music and have dance parties. There's all sorts of things that are pretty standard as well. But they definitely do utilize that outdoor space to the maximum.
What a positive way to end an outdoor space, one of my passions. So thank
Yes.
you, Roshan, for sharing that. It is the top of the hour and you've stuck with us. Thank you so very much. We have a few things we want to share with you before you pop off. And so Janet is going to share some slides to prompt me where I'm headed next. The first you will see is a slide for the 2025 Mobilize the Movement, the 2025 CFI conference, and it is going to be spectacular, and I'm not biased at all in that opinion. Lots of incredible speakers, just like you have heard here, Roshan and the great knowledge that he brings. So please check it out. Go to the QR code, or I believe Janet has also put a link in. When you go to the link, you're going to see lots of different things. You'll see the program, you'll see registration, you'll see information about my hometown, St. Louis, where we're inviting you to come, and lots of great things to do. So check that all out. Also check out the rest of the pre-conference webinar series. It is a series of 5 programs. And this ties into a question people asked about whether you're going to be able to get a copy of the recording and all kinds of things like that. If you go to the agenda for the conference, it's a little bit funky, but go to the agenda on Monday, and at Monday at 2 o'clock, which is the time this was on Central Time, you will find all 5 of the pre-conference webinars listed. Those that have not happened yet have a registration link. This one, within the next couple of days, we will have a copy of the recording, and then we will also get you a copy of the slides, which I understand were good sharing. And I'll also work together with Roshan with some of the questions and answers and see if there were some that we were not able to get to, and see if he can possibly help us type up some of those answers and get those to everyone and get that conversation going. So hopefully that'll be okay. And so join us for that series. The next one coming up is, in fact, technology. Whoops. We got this. Here we go. Technology, a tool for building and growing foundation of person-centered care and empowering staff. And we know in this day and age, we are needing to look to technology to support our staff, to support the elders that live in our community. So please join us for that one. Another great thing coming up for the Greenhouse is sponsoring an event. It is Beyond the Blueprint, the Future of Small House Elder Care Design. It's going to take place in Loveland, Colorado on June 3rd and 4th. A very interactive and engaging opportunity to spend 2 days with people who are experts in this field, who have not just seen it from the theoretical side, but people who have actually lived this, are experts in providing, have done the operational side. So some great insights, some great knowledge that could be had by participating in that opportunity. And then the last thing we want to share is, if you have not listened to any of the Elevate Elder Care podcasts, we invite you to do so. There are some phenomenal speakers. You're going to hear some speakers in the next couple months that are folks that are going to be at the CFI conference in August. There's also the 2025 CFI conference preview is one of the podcasts that's on there right now as a recording. So we would invite you to see that. So again, I want to thank you so very much for being here. One last thing. If you are a nursing home administrator and would like continuing education, for 1 hour continuing education for this, you will need to fill out the survey. And I didn't see if Janet put a link to the survey up. but we'll be sure you get you a link to the survey. Be sure you fill it out so that we can get you that CE certificate. It is good for 1 participant hour. So I think that's about everything. Roshan, I thank you so much. I know it's 10 o'clock now for you, so your day is over while some of the rest of us are still in the midst. But thank you so much for sharing your expertise. I understand you're going to be with us in St. Louis in August. And one of the things that we will be doing at the conference is one of our Wednesday morning breakfast meetups is going to be with some future leaders, those people that are truly the bright stars that those of us on the other end of the scale, let us know that the future is bright, that there are people out there with the passion to carry on this mission, to keep it going, to take it farther than even we can imagine right now. So thank you for being one of those people. Thank you for sharing your time and your talents with us here at Center for Innovation.
Of course, thank you. Thank you for having me, and I hope everyone could take something away from this.
Okay.
The
Thank you.
survey for everyone will pop up as soon as you close your window and exit. It will pop up for you to please answer the survey questions.
Thank you, Janet.
Bye, everyone. Take care.